Hello, good morning viewers. You're welcome to today's edition of Good Health Weekly on Vanguard Live, your program on total wellness and healthy living. My name is Chioma Obina. I'm your anchor for today's edition. Today we're looking at skin bleaching as part of activities to mark this year's World Skin Health Day with the theme Skin Care and Sun Protection. It is no longer news that Nigeria has become a big market for the sale of lightening products. This may not be unconnected with the fact that most Nigerian women believe that light skin is associated with beauty, higher status, and privilege. Unfortunately, there are conflicting reports on the number of Nigerians using bleaching products. While a controversial report related to WHO says 77% of Nigerian women are using bleaching products, many Nigerians have come out to criticize this report. Unfortunately, the same report says in Africa, 4 out of 10 African women are bleaching their skin. However, this week, Nigerian doctors, under the auspices of Nigerian Association of Dermatologists and Dermatology Society of Lagos, joined the rest of the world to mark this year's World Skin Health Day. Today, I have with me in the house a senior registrar in dermatology, Dr. Folakemi Cole Adife. Doctor, you're welcome to Vanguard Live.
Thank you so much. It's a pleasure to be here.
Thank you. We also have in the house Dr. Irene Akwara, a dermatologist with the General Hospital Lagos. Doctor, you're welcome to Vanguard Live.
Thank you so much. It's good to be here.
Yeah, doctor. Bleaching has become almost a way of life in this part of the world. Even parents are now bleaching their children.
Yes, it is a cause for concern, a serious cause for concern. We have a lot of people, like, the WHO study has said up to 77%, though that has not been confirmed, but it may not be too far from the truth, and that's the reality. So many people are now lightening their skin, and even more disturbing is that parents are now also bleaching or lightening the skin of their children, and it's a very, very serious issue in our society today, bleaching.
So your opinion, why do people bleach, and what are the implications? Are there really implications?
Well, why people bleach? The first thing is there's this notion that lighter skin is more beautiful than dark skin. And there are studies that have shown that people with lighter skin tend to have more they have a social-cultural advantage over people with darker skin in terms of getting jobs, in terms of getting suitors, and that is a big problem. So that's one of the things that is driving bleaching in our society. There's this kind of, I would say, somewhat of an inferiority complex in a lot of people, thinking that it's only those who are light-skinned that look pretty, and the media encourages it, to be honest. When you look at adverts, they usually pick light-skinned ladies. When you look at even in there was a time some banks, you will notice that the only people that used to work in certain banks, especially at the customer care desk, were light-skinned ladies. So those things have been driving society, and a lot of people, men, women, and even young children today have this impression that to be beautiful, to be accepted, and to be able to do more, you need to be light-skinned. And pop culture, music videos, you find that the lady, the star lady in the video is usually a light-skinned person, and these things are some of the things that are driving bleaching. And to answer your question about it being harmful, yes, it has many harmful effects, which is one of the reasons why we in the Nigerian Association of Dermatologists are talking about this. And it's it's such a reason for concern that the International League of Dermatology Society has said that part of marking this year's World Skin Health Day, one of the things we are talking about and advising or doing advocacy for is sunscreen, sun protection, and skin bleaching. So it's really, really something that we need to talk about. We need to, let people know that there are so many harmful effects of bleaching. We see so many people with complications of bleaching in the skin clinics all over the country. And some of those things are not just skin deep. Some go all the way into the systems, recurrent infections, stretch marks. People, have the skin is so thin and has difficulty in healing. And, in some cases, it can go systemic depending on the product that is being used to bleach. It can cause increased blood sugar, increased blood pressure, and in some cases can affect the kidneys and put one at increased risk of developing skin cancer. So there are so many issues. And the thing about bleaching is that in the early stages of bleaching, the skin actually looks good. And that is what encourages people. But after a few years, the skin starts to deteriorate and become bad. That's why you see people having different colors on their face. Some parts will be black, some parts will be green, some parts will be red. You are not even sure what color the person is. And then you see people with their knuckles being black and his fingers white and light, And at the end of the day, what they are trying to achieve, which is to look more beautiful,
Yes.
they are not able to achieve it. They now begin to look scary, and everybody knows, oh, this one is bleaching. So really, it's not something that should be encouraged at all.
Yes, Dr. Akwara, recently, some people are now switching over to organic products. People are claiming that some of the distributors and sellers are saying that organic products are better than the normal bleaching creams. How true is this? Can you please shed light on what's organic?
Yes, well, as Dr. Falaki has already stated, there are many bad effects to skin bleaching. And the effects happen whether you're using organic or inorganic products. To be fair, even the inorganic products do come from organic products, so it's basically the same thing. And I don't know if you remember, when we were much younger, one of the things people used to do before, they used to use the water from cashew nuts to try to lighten their skin. And I remember all the people I saw then, they always used to get burned, or they have all these bad marks on their faces when they're using. So there's really not much difference using the so-called organic products. The other thing again is to know that in Nigeria we do have a body that regulates drugs, which is called NAFDAC. So most, if not all of these products are not registered by NAFDAC for what they are doing. So because of that, two things. One, you don't know what is inside. Some people say it's organic, but it's not 100% organic. They would have still added some things inside and they will not tell you. Then two, you don't know the amount of the inorganic and the organic things they have added, which can be poisonous. So for instance now, let's say you take a drug like quinine, which is gotten from a plant. If you take too much of it can cause you to become deaf or even have all kinds of conditions, but it's still a natural organic product. So just because it's organic doesn't mean that it won't be harmful to the body. I think what is just happening is that people are trying to remove what they feel are the bad labels of bleaching so that it will seem okay for them. So in fact, here you are saying bleaching. In our clinic, I don't see patients who say they are bleaching. They tell you that they are just toning or they are just maintaining their color, or they are just brightening their skin. So that's why it's okay. Let's not say it's chemical anymore. We're using natural products. But it's still the same thing.
Okay, you just mentioned brightening and toning. What is the difference? Are there really difference between toning your skin and bleaching your skin?
Most of the time, there's no difference. People just use something that is less offensive. So, a lot of people that say they are toning, they are actually bleaching. But in the actual sense of the word, there are toners, there are skin cleansers and toners that help to, cleanse the skin or clean the skin, which sometimes can be recommended. But they are not recommended for lightening the skin. They are probably recommended as a cleanser or to keep the skin healthy. But in 90% of cases, when somebody says they are toning, they are actually bleaching, but they just want to use a word that seems to be more acceptable.
So if I may, get you right, are you saying that some of these products you see some of the products written toning cream, and some other ones are written bleaching cream? Are you saying that they are just the same thing? They're just
I don't think you ever see a cream that's the right bleaching cream.
I think I have seen some.
I've not seen in recent times. I haven't seen.
I've seen skin lightening.
Yes. You see skin lightening. You see skin whitening.
Skin toning.
You see skin toning. You see skin brightening.
Yes.
Now there are some toners like liquid for maybe someone who has acne, pimples. There are some liquids that can be used to clean the skin, to try and remove some of the dead cells on the skin. That is not bleaching, and sometimes that can be recommended by a dermatologist. But the reason for using it is not for lightening the skin. So whenever you have a cream that they say is in quotes a toning cream, most of the time there's actually a bleaching cream, but they're using a word that doesn't make it feel so bad, because there's a lot of negativity attached to bleaching. So people look for something, what we call euphemism, look for something that doesn't bring too much negative, connotations. So
yes, I will come back to you. Dr. Erika, you just mentioned, NAFDAC while you were, talking a while ago. Will you say the NAFDAC is really doing a lot, in terms of checking, the importation of these products, or distribution of this product, or even access to these products? Will you say the agency is doing, very good in that area?
Well,
what are your recommendations?
Well, I don't work for NAFDAC, but the Nigerian Association of Dermatology has had associations with NAFDAC. I mean, the former DG was actually a special guest at one of our conferences here in Lagos, Dr. Uri, the past DG. And one of the things that we came to understand is how drugs or compounds are registered at NAFDAC. So, for example, NAFDAC doesn't only register drugs; they also register food, substances, and additives, and even creams that you can use for your body or hair cream. So somebody can bring in a compound saying that this is a body cream, but knowing that it's for bleaching, and because of that, NAFDAC will only check it to see whether it should be used as a body cream. They will not be looking at it as a bleaching cream. So they might even have NAFDAC number, but the NAFDAC number is for this thing to be used as something else, but it's now sold as a different thing. And when you have scenarios like that, I'm just speaking from my own way I see it, it will become difficult for NAFDAC to actually monitor all these things. There are reports even in Europe, like England and some parts of East Africa, where they have tried to ban this thing by law, but the people circumvent the law by bringing under a different name and claiming that, oh, we're not using, just like you are saying that we're not using it for bleaching, it's being used to rub your feet, it's used to wash your hands. But when they come out of the NAFDAC office, they write different things on the packet, they will put different posters on the newspaper. So that's where the problem is.
In addition to, as a suggestion, what we discussed at one of the previous meetings of the Nigerian Association of Dermatologists is it would be nice if NAFDAC, works hand in hand sometimes with the dermatologist, especially with regards to skincare products, because it's important for them to know, okay, when a product is being produced, the active ingredients, because sometimes the active ingredient may not be, like Dr. Clara said, may not be recommended for what is actually being used for. And we have so many products in the market that are NAFDAC registered but are not being used appropriately, especially steroids, because steroids are used by a lot of people for lightening. And it's interesting to note that many steroids that are available in the market are very potent, what we call very strong steroids. And some of them, quite a number of them, are not even meant to be used in children at all. Anyone below the age of 12 should not even come in contact with such potent steroid, because it can be absorbed directly into the bloodstream and cause problems. But you find that a lot of products have these steroids in them and are being marketed for use even in children. So some of those details, it would be nice if NAFDAC can work hand in hand with dermatologists so that they can be advised, oh, this particular product is okay for adults, but it is very harmful for children. Or even in adults, it should not be used in this quantity or in such a manner. It is only to be used on prescription, and not to be sold over the counter as is being done today.
Yes, doctor, I want to take you back to the issue of cancer and bleaching cream. Can you tell us what is really the link? You just mentioned it in the while ago, but what is really the link between cancer and bleaching creams?
Well, there are not enough studies yet, but we can infer, and the reason being that the reason why we are actually dark in this part of the world is because of sun. So our dark color skin is a natural adaptation for sun protection. So we find that people who are lighter don't have as much melanin, which is a pigment in the skin that helps to absorb harmful sun rays to prevent it from getting into the skin to cause damage. And the damage it causes is DNA damage. When the DNA is damaged, cancer can occur. And this is the reason why people who live with albinism, who have no melanin, that is the defects that is in albinism, they are more at risk of skin cancer. And that's because they do not have the natural melanin that dark skinned people have. It's also a reason why skin cancer is very common in Caucasians, white people. That's because they have a type of melanin that is not as effective as absorbing, they have melanin, but it's not as effective as absorbing the harmful sun rays as the melanin in dark skinned people. So when people then have melanin on their skin and use lightening or bleaching creams that would reduce the melanin in their skin, they are going to be, and they are living in an environment like Nigeria, which is a tropical environment, they are going to be at increased risk of the harmful sun rays on the skin. So, and it's not something that will happen immediately. It may take years. So we are expecting that in a few years' time, if people continue to bleach their skin, we are going to see an increased risk of skin cancers. And that's because the normal protection that we have, a lot of people are removing it. So they'll probably be at the same level of risk as Caucasian or people with albinism who live, who are known to have an increased risk of skin cancers.
Hey, doctor, I want to take you to the hospitals where you work.
Yes.
Have you seen some cases like this in the hospital?
We are beginning to see cases like that. We are beginning to see cases like that, and it's worrisome because we are now thinking that if by now we are already having that, what will happen in 5-6 years time? And you know that things like cancer, they are not things that happen immediately. They happen as a result of maybe a long-term damage. That's why a person who starts smoking today, they are not going to develop lung cancer today, but maybe in another 20 years time, if they have the predisposition to lung cancer, they develop it later on. So it's pretty much the same for other types of cancers. It's something that may not happen immediately. So over time, we are hoping that we can do enough advocacy so we do not begin to see an epidemic of skin cancers in our people. But we are seeing the effect of sun damage, increased effect of sun damage on the skin due to people lightening or bleaching their skin. And that's because most people don't even know about sunscreen, which is what is advised. Rather than bleaching the skin, use a sunscreen cream. A sunscreen is a cream that acts as a block. So when you apply it on your skin, it prevents the sun rays from penetrating into the skin. And it's the sun rays that penetrate into the skin that stimulate an increased production of melanin as form of protection. So if those sun rays are not penetrating into the skin, people will not tan as much. And that's what a lot of Caucasian or white people use to prevent sun tanning or darkening. So when they go out in the sun, we are always advised to use it, especially in Caucasians, and it even has some benefits in us dark skinned people. Another thing that sun protection helps with is reduction in aging. So your skin doesn't age as rapidly, because one of the things that causes aging, people to look older faster, is actually sun exposure. So the sun protection will reduce the tanning or the darkening, that's the sunscreen. It will also reduce the rate of aging, so it can help people to stay looking younger for longer, which is what everybody wants at the end of the day.
Yeah, if you are just joining us, this is Good Health Weekly on Vanguard Live. With me in the house are members of the Nigerian Association of Dermatologists. These are doctors trained to take care of our skin. Doctor, coming back to you, we're just giving us, the things to do to take care of our skin. Since bleaching cream damages the skin, what are the healthiest way to take care of our skin without bleaching?
Well, the first step to taking care of the skin, we always say that care of the skin starts from within. It's not just about what you put on your skin that's important, it's also what you take into your body. So the first step in taking care of your skin is good diet, eating healthily. And when we say eating healthily, eating a lot of plant-based foods, fruits, vegetables, drinking a lot of water. Hydration or enough water is very important for maintaining a healthy skin. So we would say start by eating more vegetables and fruits. The WHO recommends 5 portions of fruits and vegetables every day. Every day, not every week. So in a day, you are meant to take at least 2 fruits and at least 2 or 3 portions of vegetables. And then drinking at least 2 liters of water. In our environment, it should be up to 3 liters because we live in a very hot tropical environment where we sweat a lot. So we advise people to drink as much as 3 liters of water every day. It helps with the whole body, including the skin. If one is not healthy inside, it will show on your skin. So it's not just about rubbing creams on the body. That's the first step. Then in terms of skin care, using a very mild soap. We are against the use of medicated soaps because medicated soaps also cause problems on the skin. So using a mild soap that is not medicated, a mild toilet soap to wash. Sometimes in a lot of people, too much scrubbing of the skin can also damage the skin and make it age faster. So even though we are used to scrubbing our skin in this part of the world, it's not exactly the best for the skin. A soft sponge or face towel is enough to clean the skin. Trust me, you will not be dirty. I've not used a sponge.
Even with all the heat in Lagos?
Yes, I've not used a sponge in over 15 years. If I use a sponge, I itch. So I just use soap. And a lot of people, we advise them to stop using sponges when they talk about itching after having a bath. So that's another way to keep your skin. Then using a good cream, just a plain cream. You don't need to use anything toning or lightening or anything. Depending on the kind of skin that you have. Some people have oily skin, some people have dry skin, some people just have what we call combination skin. So people who have dry skin, they may need more of a water-based lotion on their skin, a plain lotion, which there are many available in the market that one can use. Some people can use plain products like shea butter. which is very good for the skin when it's not mixed with any other adulterated product, just plain shea butter or Vaseline most of the time.
How about our local soap, the black soap that are locally made? They also
Well, there's a lot of research going on about our local soaps. We find that quite a number of them are quite good. However, the problems we have generally are problems of adulteration, problems of hygiene. So in cases where people are not using clean water to make these things or not storing them appropriately. But I think we do have a lot to learn from our people, and if we can standardize some of the processes of how we make our local soap, it may be useful for us, yes,
Yeah.
in the future.
Yes, Dr. Aquara, I'll come back to you, Doctor.
Yeah.
Like, now, I have are there implications for a pregnant woman, to use bleaching cream? Are there implications for the unborn baby?
Okay, yeah. Well, in addition, before I even go there to what Dr. Flake has even explained, cancer is one of the long-term complications, but there are immediate things that you will see when you're using a bleaching cream. So the first thing you're going to notice, of course, is that your skin becomes lighter, which some people will be happy with. But after getting lighter, the next thing you start seeing that you can see your veins and things like that, which is not beautiful at all. Then the second thing that happens is that the skin actually becomes very thin. So if you were to hold that person, which I have seen, the skin can just tear easily and you start bleeding. And that one happens a lot. That one is something you see. Somebody will fall down, hit his leg. Instead of just for there to be a swelling, it will be as if a knife cuts the leg and blood starts coming out. Then when they come to hospital, we try to sew it back. The stitch will not stay inside because the skin is too soft, so that even the thread that are using to sew it is tearing through the skin. We see that a lot. So imagine if that kind of woman that came to a hospital, she's pregnant, she wants to deliver. They make an incision on her stomach, they want to sew it back. A wound that will normally heal within 7 days, 2 weeks, 3 weeks, 4 weeks,
Yes.
she's still on the matter.
And there have been such cases.
It happens a lot.
Yeah.
But are there really implications for the unborn baby?
On the unborn baby, it can happen if there are some bleaching products some people now take as injections and as tablets. So when that one happens, that means that thing can get into the woman's blood, from the blood cross into the baby's blood. So especially for things like steroids, they don't normally, you are not supposed to give pregnant women steroids, because when you give them steroids, it does things to the baby. It can make the baby to mature very fast, or it can retard the growth of the baby, so that when the baby comes back, instead of just being normal, it's already affected by the drugs that they are. So it is possible for that to happen. And the only thing, as you said in the beginning, that we don't have that much data or study into all these things. So all these ones I just give you the local simple examples that we do see every day. So babies can be affected by the mother taking using bleaching creams or bleaching products, either as injections or tablets.
And also to add to that, if the mother is affected, the mother will not be able to take care of the baby.
Yes.
So in a way, the baby will be affected. Imagine a woman who puts to bed via CS or even has a tear, and because of the bleaching, she doesn't heal on time or has infection. She will not be in a position to care for her baby when the baby is born, because she will be hospitalized. And that can have effects on the child if the mother is unavailable.
Yes, in other parts of Africa, some countries have banned the use of bleaching cream.
Yes.
But you see that today Nigeria is a big market for bleaching cream. Would you subscribe same to Nigeria?
Well, I believe there's a place for that, but banning bleaching products without first doing enough advocacy and awareness may just drive an underground market, and may not really help. So I think the first step would be to let people know how dangerous these products are, how they can affect people in the long term, affect their children, affect themselves, and try and get people to stop using them. with or without a ban. The ban may help, but if the ban is done before this awareness or advocacy is done, it may not be as effective as it's meant to be.
Yes, doctor, because of our time, just a few days ago, the association put out to mark this is World Skin Day.
Yes.
What are the things you do?
So many places all across Nigeria, various branches of the Nigerian Association of Dermatologists went into the streets, went into the university, the market, the hospitals, and spoke to people about the side effects or the harmful effects of bleaching. And it was very successful because we were able to reach out to thousands of people all over the country: Kaduna, Abuja, Ibadan, Uyo, Port Harcourt, Benin, Asaba, and Lagos here, Owerri, so many places. On the radio, we've been on radio shows, we are here today, and it's very important because we need more awareness about the harmful effects of bleaching, and also educate people about using sunscreen as opposed to using a bleaching cream. And we're even going further. We have a program coming up in 2 weeks' time where we're going to be talking to our fellow doctors, general practitioners, nurses, and pharmacists about how they can promote skin health, and also how they can stop prescribing harmful skincare products for patients. Yes.
Okay, one last one from you, doctor, before we go. What is your message to Nigerians out there, especially the women that are mostly into this bleaching thing?
I think the message to Nigerians, and we can say mainly women, but we now have men who are also bleaching,
yes.
so it's goes both ways, is that we should really start to believe and practice that black is beautiful.
Oh yes.
It's not easy, but it is something we have to face. I think before you even ban the thing, you should go to why people are doing it. And for me personally, I am not aware that if I see somebody, the first thing I'm going to use to judge or grade you is the color of your skin, because you didn't really do anything to earn it. It's what God gave you. So we should be happy with what we have. There's an effect from all these bleaching that we haven't talked about, which is that none of these creams are cheap. We spend money on it. We're in a recession. People don't have enough money to eat. Let us spend the money eating and drinking and making ourselves happy rather than spending on something that is likely to affect our health. Let us believe that black is beautiful.
Black
That's my
is
message.
beautiful. Yes, like the expert just said, that black is beautiful. Thank you, viewers, for joining us on today's edition of Good Health Weekly on Vanguard Live. See you next week, the same time, same station. Thank you very much.
Thank you.
Thank you.